If you're watching this video, it's likely that you, or perhaps your child, have just gone through the traumatic experience of a shoulder popping out of its socket. It hurts, it's frightening, and at the emergency room, they sent you home with a brace and a reassuring phrase. Keep this on for 3 weeks, then do physical therapy, and you'll see it'll be good as new. Well, I have to tell you something you might not like, but it's crucial that you know it today. If the patient is young, let's say under 20 years old, and perhaps plays sports, that wait-and-see advice is old, it's outdated, and according to modern scientific guidelines, it could even be harmful to the future of that shoulder. Hello everyone, I'm Dr. Lorenzo Castellani, an orthopedic surgeon specializing in shoulder, hip, and knee surgery. Here on the channel, I help patients understand joint surgery, unfiltered. If you want the truth about your health, subscribe to the channel. If you find this video helpful, give it a like and let's move on. Why do I say that waiting is dangerous? To understand, I need to explain how the shoulder is built. We don't need 3D graphics, just a few words will do. Imagine the head of the humerus, the arm bone, is a sphere, and the scapula is a slightly welcoming surface. The shoulder is the most mobile joint in the body, precisely because it's built this way, a large ball on a small, almost flat surface. It moves wonderfully, but what's the price to pay? It's unstable. What holds it in place? Ligaments that act like mooring ropes, and a gasket called the glenoid labrum. When the shoulder dislocates for the first time, it doesn't just move, and that's it. It tears that gasket. It's like taking a door off its hinges. Now, let's go back to the 18-year-old with the brace. Until a few years ago, the medical practice was, let's wait. If it dislocates a second time or a third, then we'll operate. The new guidelines have completely overturned that. Why? Because the numbers are unforgiving. Statistics tell us that in a young athletic patient, especially if they're under 20 years old, after the first traumatic dislocation, the probability of the shoulder dislocating again is extremely high. Some studies report an 80% recurrence rate. It's not a question of if it will happen again. It's almost certainly a question of when. And here we get to the crucial point. Many people think, oh well, if it dislocates again, I'll just pop it back in and then get surgery. No, that's the mistake. Every time the shoulder dislocates, it doesn't cause the same damage as the first time. It causes new and worse damage. The first time, you tear the ligaments. The second time, you start to chip the bone. The third time, you create a groove in the bone. Doctors call this a Hill-Sachs lesion, or bone damage to the humerus. Sometimes, a fracture of the scapula occurs, called a bony Bankart. Imagine repairing a torn piece of clothing. If you sew it right away, it's perfect again. But if you wait for it to tear another 5 times, so much fabric will be missing that it'll be hard to piece it back together. And you might even need a bigger operation, one that also reconstructs the bone. This is why today we tend to operate after the first episode, to repair the tissue while it's still good quality, biologically ready to heal, and the bone is intact. So, my advice today is this. If you're over 40 and have a sedentary lifestyle, then maybe conservative therapy with a brace is okay. But if you're under 20 or 25, if you're an athlete, don't just settle for a wait-and-see approach. Make an appointment with an orthopedic surgeon who specializes in the shoulder. Ask them explicitly, Doctor, given my age and the risk of recurrence, should we stabilize the shoulder right away with arthroscopy? A small arthroscopic procedure today, meaning with 3 small incisions and a camera without cutting everything open, can save you from a much larger and more complex operation if the shoulder continues to dislocate. Protect your shoulder. Don't wait for it to be irreparably damaged. And what about you? Has this happened to you? Let me know in the comments if, after a shoulder dislocation, you were advised to use a brace and do physical therapy. Tell me how old you are and if your shoulder continued to pop out of place afterward. Did you end up having surgery? How did it all turn out? Write it down below so it can help other people in your same situation. If you found this video helpful, please leave a like and subscribe for more content on orthopedic health. If I've earned your trust and you're in this situation, you can book a specialist consultation with me by contacting my secretary. You'll find all the contact information on my website. If you're far away and just want a personalized remote consultation, my secretary can help you arrange that. See you in the next video.